This recording will go over the following antihypertensive classifications: central acting alpha-2 agonists, alpha adrenergic blockers, adrenergic neuron blockers, and also alpha-1 and beta-1 adrenergic blockers. So first we'll talk about centrally acting alpha-2 agonists. And if you remember back to when we talked about these receptors, alpha-2 is the one that's not like the others, where in terms of lowering blood pressure, other medications are going to be blocking the beta receptors, blocking the alpha-1 receptor. Alpha-2 medications are agonists, right? Because alpha-2 receptors are different from the others. These medications stimulate the alpha-2 receptors, which in turn decrease sympathetic activity, increase vagus activity, decrease cardiac output, and decrease serum epinephrine, norepinephrine, and renin release. All of these actions result in reduced peripheral vascular resistance and increased vasodilation, and that's what helps to decrease the blood pressure. The prototype drug that you need to know as a centrally acting alpha-2 agonist is clonidine. In high doses, clonidine can cause sodium and water retention, so frequently you'll see it administered with a diuretic. Clonidine is available in a transdermal preparation that provides 7-day duration of action. So it's important when you see someone with a patch on that you know what the patch is and how often it needs changed, right? Because clonidine patch is a 7-day patch. It's not something that's changed daily or removed at night or anything of that sort. Transdermal patches are replaced every 7 days and may be left on while bathing. Skin irritation may occur. Some side effects and adverse reactions of alpha-2 agonists include drowsiness, dry mouth, dizziness, and bradycardia. This group of drugs must not be abruptly discontinued because a rebound hypertensive crisis may result. If the drug needs to be stopped immediately, another antihypertensive drug is usually prescribed to avoid rebound hypertensive symptoms such as restlessness, tachycardia, tremors, headache, and increased blood pressure. The nurse should emphasize the need to take the medication as prescribed. Alpha adrenergic blockers, or alpha blockers, result in vasodilation and decreased blood pressure. They help maintain the renal blood flow rate. Alpha blockers are useful in treating hypertension in patients with lipid abnormalities, so cholesterol issues. Alpha blockers decrease LDL, or the bad cholesterol, and increase HDL levels, or good cholesterol levels. Alpha blockers are safe for patients with diabetes because they do not affect glucose metabolism. They also do not affect respiratory function. Your prototype alpha blocker is prazosin. When prazosin is taken with alcohol or other antihypertensive, the hypotensive state can be intensified. Alpha blockers can cause sodium and water retention with edema. Therefore, diuretics are frequently given concomitantly or together to decrease fluid accumulation in the extremities. Side effects of alpha adrenergic blockers are listed there for you. Orthostatic hypotension, again showing up, manifested in the patient with dizziness, faintness, lightheadedness, and increased heart rate. Side effects also list edema, weight gain, that's related to the sodium and water retention that can occur when the patient is taking this medication. If the patient takes an NSAID with that medication, they might see increased edema. Prazosin has a decreased effect when taken with NSAIDs. Any other antihypertensive medication or alcohol can cause increased hypotensive effects of the medication. Your prototype adrenergic neuron blocker is reserpine. Adrenergic neuron blockers are potent antihypertensive drugs that block norepinephrine release from the sympathetic nervous endings, causing a decrease in norepinephrine release that results in lower blood pressure. A decrease occurs in both cardiac output and peripheral vascular resistance. Reserpine, the most potent drug, is used to control severe hypertension. Orthostatic hypotension is a common side effect, as well as vivid dreams, nightmares, and suicidal ideation. The group of drugs in this group can also cause sodium and water retention. They can be taken alone or with a diuretic to decrease peripheral edema. Labetalol is your prototype alpha-1 beta-1 adrenergic blocker. Blocking the alpha-1 receptor causes vasodilation, which decreases resistance to blood flow. The effect on the alpha receptor is stronger than the effect on the beta receptor. Therefore, blood pressure is lower and pulse rate is moderately decreased. The blocking of the cardiac beta-1 receptor results in decreased heart rate. Large doses of alpha-beta blockers could block beta-2 adrenergic receptors, thus increasing airway resistance. Patients who have severe asthma should not take large doses of labetalol. Please review your purple nursing process box for alpha adrenergic blockers. Again, your prototype alpha adrenergic blocker is prazosin. Please review that on your own. It has a lot of good information in it.